China Daily. I'm Feng Xin. Today we're very privileged to have invited Dr. Shao Yiming, the chief expert on AIDS from the Chinese Center for Disease Control and Prevention. Welcome, Dr. Shao.
Yeah.
Well, Dr. Shao, we know that the real name testing on AIDS has been discussed very hotly recently. So what's your opinion on the real name testing?
Yeah, AIDS is a stigmatized disease. So in the society, there's still a lot of discrimination against AIDS. So you could imagine real name testing will cause a lot of concern. Actually, anything have two sides. For anonymous testing, and it provides a better guarantee for the infected people and not be identified, not be discriminated on. But the health agencies do not know them, and the government do not know the real epidemic figure. And in the current AIDS control and prevention, you always combine prevention with treatment and care. So without knowing the people's identity, it is difficult to provide the care, counseling, and treatment for them, because the treatment is a lifelong. So you have to know the people where they are and sending them drugs regularly. And so that's it's a double-edged sword. But the policy currently in China implemented is screening test is still anonymous. So you don't need to tell your name to do HIV testing. It's only at the second stage to confirm the diagnosis, providing you a diagnostic paper documents, and then link you with the care and treatment. At that stage, we encourage patients to be identified. There is government laws, the law of China for infectious disease control, and the law of control AIDS. Both laws provided a guarantee for confidentiality for the HIV infected and AIDS patients. So any testing agency, they cannot disclose any personal information. If they do, they will be punished by the law.
I see. Is the real name testing adopted elsewhere in the world?
Many other countries, they have a similar policy. They usually, even the real name testing, you can divide them into mandatory or voluntary. So many other countries implement is still through education and to persuade people to be collaborative to giving their names. China is doing the similar thing. We still need their collaboration.
I see. Well, is the policy a result of any changes that happen in terms of the ways AIDS and HIV viruses are transmitted, or the number of cases?
Yeah, if you don't do a good confidentiality keeping, and also do not have a very good environment, a liberal and a care environment against discrimination, and the patients suspected to be infected people, they may not come in for testing. So when you want to do more testing, you may end up with less testing. So I think that this has to be pay a lot of attention to it, to implement the law, to keep the confidentiality for the patients, and providing the care, link direct care after confirmed positive. And we should also do education to tell the AIDS patients those laws who keep their rights, but also we have to educate the healthcare workers to follow the law strictly.
And what's the situation like in China right now? Have there been more people affected by HIV viruses?
Yes, epidemic figure from we have a surveillance program. We do about 80 to 90 million tests every year. So we have collected data, what we call reported HIV infection, reported AIDS, and reported AIDS deaths. The three main figures are still increasing every year, sometimes a two-digit increase. So the situation is the virus still spreading. In the recent years, we saw three major changes in the transmission mode. That is including from the blood transmission to the sexual transmission become predominant, and from the rural epidemic to a rural and city epidemic, and from a limited high-risk group population epidemic to a general population epidemic. So that means the task of the AIDS control has become bigger, and the difficulty is also become bigger.
So have there been any measures or approaches to preventing and controlling the spread of AIDS and HIV viruses?
Yeah, the State Council just issued a new 5-year action plan to further strengthen AIDS prevention and control in China. And our top leaders like the President and the Prime Minister, they regularly, almost every year, visit the AIDS patient. And the government budget keep a very heavy investment. And the new strategy is to expanding testing, expanding treatment, using treatment also as a prevention tool, and so try to scale up the coverage. The main reason for the three major figures still increasing is we do not have a wider coverage. Estimated about 30 to 50% coverage, which is not enough. We have to increase to 70-80% coverage of the targeted population, and then we can turn the tide at the epidemic.
I see. Thank you very much, Dr. Shao. It's my great pleasure having you today. Thank you.
Thank you.